Unlike in human medicine, the definition of diabetes mellitus in dogs is not as clearly established. One suggestion has been to define overt diabetes in dogs based on a consistently high fasting blood glucose concentration exceeding 144 milligrams per deciliter. This proposition aimed to encourage further examination and refinement of this diagnostic criterion. More recently, another viewpoint suggests that diabetes mellitus in dogs could be defined by a fasted or non-fasted blood glucose concentration of 200 milligrams per deciliter or greater, especially if the dog shows clinical signs suggestive of diabetes that cannot be attributed to another condition, or if the dog is experiencing a severe hyperglycemic event like diabetic ketoacidosis. This latter definition also suggests that if there is uncertainty about the clinical signs, the blood glucose measurement should be repeated, or additional tests such as urinalysis or measurement of glycosylated proteins should be performed. For dogs with a blood glucose concentration between 126 and 200 milligrams per deciliter, with or without clinical signs, diabetes mellitus could be confirmed by documenting persistent high fasting blood glucose for more than 24 hours or by finding increased levels of glycosylated proteins. These proposed definitions for canine diabetes mellitus draw inspiration, in part, from the diagnostic criteria used in human medicine for diabetes mellitus and prediabetes. This study provides compelling evidence that most dogs with randomly identified hyperglycemia, including those with pronounced and persistent hyperglycemia, do not develop a need for exogenous insulin treatment. Furthermore, the initial blood glucose concentration was not a significant predictor of which dogs would eventually require insulin. The lack of association between the degree of initial hyperglycemia and the time to insulin dependence further supports this conclusion. Therefore, the researchers strongly suggest that criteria beyond a single randomly identified high blood glucose measurement are needed to improve the definition of overt diabetes mellitus in dogs that are not yet being treated with insulin.